Coming to you from deep in the Ozarks and Ridge Runner Studios. This is the Nursing Underground, a podcast that will help clear the white noise in medicine and politics and help you define the forest from the trees. Here is your host, David Big Dave Ezel. Welcome to the Nursing Underground.
Good Sunday morning, everybody. I hope everybody is doing well. This is the Nursing Underground. I'm your host, Big Dave. Today we're going to talk about what's going on in healthcare, the closures that seem to be plaguing the country right now, and we're going to be trying to see what's going on. I would like to thank everyone for listening, everybody picking up on what's going on out there. But while you have been worried about the headlines all across the country for the last 6 months, something's been going on in healthcare that nobody's been aware of. And with the coverage that's covering into it, nobody is still aware like they need to be, because it not only affects you, it affects your loved ones. But first, we're going to get a little ad from one of my hosts. She's been with me since the very beginning. It's Amy at Rocking Magnolia Customs.
Do you have a friend or family member you're having trouble buying a gift for? You just can't find the right gift for the person who has everything? Then go to Rockin' Magnolia Customs, a place where you can pick out and design the perfect gift for that special someone. That's rockinmagnoliacustoms.com, or find them on Facebook at Rockin' Magnolia Customs.
And remember, that's Rocking Magnolia Customs. There's no G in rocking, and customs is always with a K. Marjorie was stunned to learn that she was going to have to leave the nursing home where she'd been living for the last 6 years. And the administration had notified the approximately 40 residents of their facility that they was going to be closing, which is becoming commonplace now, specifically in the rural areas. Marjorie was quoted as saying that the rug was taken out from under her. She thought she was going to stay there the rest of her life. Her son found her another room in another city that was 20 miles north of where they were, which made it a lot of uncomfortability for Marjorie, because the family was further away and they couldn't just stop in. She does enjoy the new facility, but she missed the friends that she had in the old one. She said they all felt like a happy family there, that the staff really cared for them, and she doesn't feel like she's getting that same interaction with the staff and the people that she lives with in her new facility. The pandemic brought billions of extra federal dollars into the long-term care sector, which was inundated with COVID-19 infections. There was approximately 160 to 180,000 deaths related to COVID-19 during the 2 years of the pandemic. And tons of the facilities across the country saw their business decline. The lockdowns caused their staff members to be gone. The staff members faced extra stress and extra danger. And guess what? It hadn't slacked up. They found out that they could leave the nursing home where they were making $12 to $14 to $15 an hour and go to work for places like Chick-fil-A, McDonald's, local grocery stores, not have to put up with the BS the administration gives them, the rules handed down by the government. They didn't have to wear a mask all the time. They weren't required or mandated a immunization to keep their jobs for the pennies that they were making. And we're still feeling the effects of that. I am a nurse, and I've worked in the industry for approximately 28 years. From February 2020 to November 2021, the number of workers in the nursing homes dropped by 410,000 nationally. 410,000 out of approximately 2.9 million nursing home workers, and the rest make up to about 4.1 million were in the acute care sector, hospital sector, clinics, day surgery centers, et cetera, stuff like that. But within the long-term care sector, we lost 160 to 180,000 residents. We lost 410,000 staffing members, and we've only gained back approximately 100,000 since all the regulations and stuff have been eased. What's happened with this, though, is that nursing homes that don't have the staff to maintain and keep open the beds available means that the facilities had to either close beds down, close units down, or just close because they can't mandate staff, they can't keep staff. Like I said before, you have that going on. You've also got the availability of open nursing home beds blowing up in certain areas of the country. Patients in hospitals are waiting weeks and weeks and weeks for bed placement, which is super important inside the nursing home industry. The care industry leaders say that they have increased wages for frontline workers. I don't see it. They say that's largely because they rely on payments from Medicaid. That's the state government system for making payments to that. Low-income America's covered with Medicare and Medicaid. If they're Medicaid only, they get long-term care. Most states have increased how much the Medicaid programs pay nursing homes, but the rates are so far behind the industry and the advancements of the industry. And if you get advancements of any industry, we all know it's a supply and demand issue and the cost goes up. The rates are less than what the facilities need to stay awake. Iowa, for instance, the Medicaid pays nursing homes about $200, $215 a day per resident. But if they were charged somebody private pay, it would be $253 a day. And when you got somebody going in for short-term rehabilitation for Medicare patients, those guys usually get about $450 per day. But the Medicare program does not cover what we call long stays or long-term care. About 72% of Iowa's nursing homes that are left open, they're already freezing and limiting admissions that are below their capacity. Sorry, I'm recording remotely this evening. Hospitals are having a hard time placing the residents into these nursing home, long-term care facilities because of lack of availability, facilities closing, lack of staff causes no beds to be on. So that means they're being held in hospitals for weeks at a time. And when you hold patients in a hospital waiting for nursing home bed placement, it backs up the EDs because they don't have the staff either. They're having the same problems finding staff that long-term care folks are having. So these social workers are kind of caught in the middle, and I understand that. But I hadn't heard any of their groups call for help. I haven't heard them say we need to get the government involved here to help us out. In Ohio, nursing home operators, they're saying that they're unable to fill approximately 130,000 vacancies. If you take 130,000 vacancies just in Ohio, guess what? That's the population of Dayton, Ohio. The chief executive of the American Healthcare Association, Mark Parkinson, idiot, says it's an unprecedented situation. It's impossible to exaggerate the challenges faced in providing care due to the inability to hire workers. This, he said, is an unprecedented worker crisis. Okay, as you can tell, I'm not a fan of the AHCA. They're a lobbying group. They lobby for rules. They don't lobby for money. If they were really worried about what was going on in these long-term care facilities, they would be lobbying the government for money. He says it ain't like the restaurant industry, where if there aren't enough staff, the place closes on Mondays and Tuesdays. and nursing homes were open 24/7. No, duh, it's a medical facility. 1.3 million of America's most vulnerable elderly people are already in the skilled nursing homes. More elderly people need care every day. If you've made it to 45 to 55, guess what? The odds of you ending up in a long-term care facility is approximately 50%. What happens is you don't have enough staff. People don't get rooms. People don't get rooms. They stay in the hospital, especially if they're needing directed medical care. And if they have the rooms in the hospital, the people in the emergency department that come in, because accidents happen, infections happen, things happen, they don't get a bed upstairs in the hospital, or they don't go down the hall to the hospital. The problem is, although the pandemic made matters much worse, we weren't in great shape to begin with, believe it or not. That's the point that's missed here. This isn't new. The pandemic exacerbated the issues that's going on now. The deal is you've got these private companies that own these long-term care facilities, and the bottom line is all that matters to them. They will cut costs, they will cut staff, they will cut it back to meet their expectations of profit margin. Sad to say, but the truth is the truth, and nobody's dumb out there. Y'all understand that. There's really not a shortage of nurses. There's not a shortage of medical care people. There's not a shortage there. What there is a shortage of, though, is people that's willing to do what they're told to do for the money they're paying them. I'm sure if you paid them more, they'd take a lot more punishment. But at the current rates, it's not happening. And you've got facilities calling each other and setting the rates instead of trying to. That's what the AHCA does. It makes them call the other facilities so they don't take all the staff and the help because they paid more. I'm sorry. The supply and demand issues should be followed. You want to pick the cream of the crop, you pay cream of the crop prices. You want to build a real nursing home facility and we use a 5-star rating system in nursing homes. It's a quality system. It tells you if they met all the criteria, their billing practices were good, their staffing is good, the building is good, the maintenance of the building is good, the quality of care they receive and the quality measures that they keep up with, how many immunizations for the flu were given, and UTI counts and dehydration counts and all this stuff that nursing homes have had problems with for years are all generated because they won't allow the facilities to pay what they want to pay. If you live in an area where the rates are low, then most of your nursing home costs, LPN in a rural area in Arkansas makes approximately $21 to $24 an hour. That is unreal, ungodly, and uncalled for. If you want the best, you want the best ones, then you might have to pay $28 to $32 an hour, and they act like that's an exorbitant amount of money, and it's really not. You get what you pay for, number one. Number two, you don't get them if you don't pay for them. So how do we fix it? We don't know how to fix it. Nobody knows how to fix it. I know how to fix it. The people that work in them know how to fix it. But the administration and the privately owned companies refuse to do it. They refuse to. It's all about the bottom line. It's got nothing to do with do they care about the resident or not. They do care about the resident. I believe they actually do. The problem is, do they care enough about the resident to give up that profit margin? Apparently they don't. And they would rather close a building than lose money. I get that point too. If you raise the rates and you increase the staff, you can take more patients in the building. That makes up for what you were losing before. You keep those people, you get your stars up, you get a rehabilitation company in there that knows what they're doing when they're giving rehab. That means they know how to give rehab, give good results, get the results done in a quick fashion, get them in, get them out, you move them across. Yes, you can do it. You can get the amount of money you need to pay your people then. It's a long-term process, and these businesses will not lose money for 2 or 3 years to make the long-term investment. They just don't do that anymore. Facilities are turning patients away. They say they're not. But you can look this up all on the internet, folks. You can see these people that they're talking about. A lot of these facilities are bringing in more patients than they've got employees to take care of them. That causes stress, burnout on these employees, and that causes them to lead to possible abuse of a resident. But the facilities act like they're not responsible for what happens because their people are tired. Massachusetts Health Association released a report. They had 891 patients in hospitals statewide that were waiting to be transferred to skilled nursing hospitals, long-term care hospitals, rehabilitation centers, nursing homes. The entire system is screwed. Massachusetts has a issue that about 1 in 4 jobs in nursing facilities are vacant. They're hollering in Massachusetts, well, it ain't going to stop till 2027. Well, if let's take, for instance, that you got a nurse that's working for $24 an hour, and they're putting up with all the BS and the rules and regulations and the mandates handed down by the government and other facilities, but yet they find a job at Hobby Lobby paying $21 an hour to be an assistant manager. What do you think they're going to do? Better working hours, days off with pay, better time and quality spent with their family after work because they're not so damn tired they can't sit in a chair and forced to try to keep their eyes open. Or they get home from work, have to cook dinner. They're so exhausted as soon as they sit down, their eyes close and they go to sleep and they don't see their family. See, there's all kind of things that factor into these decisions people make that work in these sectors, and nobody takes them into consideration. A company doesn't say, well, we probably need to back off of this rule because it might cause our employee to be dissatisfied in their job and they won't stay. Here's a problem. Okay. About 35 to 37 years ago, they called a special session of Congress. Because at that time we were having patients dying in the hospital parking lots waiting to be seen. And it was a problem. You had patients being shipped to other hospitals and being dumped on. Nobody knew they were coming. They'd pop, just showed up. That's when they enforced the ED Act. If you showed up to equal access, I think is what it was called, equal access and patient dumping or something like that. I didn't think I was going to talk about it, but it's true here. They called a special session of Congress to fight this problem. I have not seen or heard anybody calling for a special session of Congress for the crisis that we're currently in. It's just nursing homes. Nobody cares. It's just the nursing homes. We changed the outcomes of people 35 years ago by calling a special session of Congress and funding what they needed to fund to get the jobs done. Now you don't have that. You have a boarding situation in emergency rooms that's causing people not to be taken care of. That's what it amounts to. Now, whether they're upstairs in the hospital, if they're in the emergency department, being partially taken care of, because it's still an emergency room. They still have a flow they have to maintain. And instead of having a couple of hours of wait, sometimes in an emergency room, which we think is horrible, it's not. Now we're going into days. because they don't have the beds available, because people are waiting days to get beds upstairs, or people are waiting days to be moved from the acute care units to the long-term care and rehabilitation centers. They're waiting days and weeks, even months to be placed, and that causes a backup in the ED, which causes a backup in the waiting room. We're right back to where we were 35 years ago, folks. All because the government doesn't care, and I thought we had made such great advances with the 2012 American Care Act. That apparently is not the case. I've not heard another excuse me. I've not heard another representative or senator say anything about what's going on right now, and you're not going to hear it. 1 in 10 emergency room department are sick. They require admission. The minimal amount of wait for a bed in one state was 9 hours. Minimum. That's a whole shift usually. If they're working 8-hour shifts, it's a whole shift. Nurses are being crushed under the weight. Profit driving, staff crisis. It's been going on for years. The hospital nurses, I feel absolutely sorry for, because they're having all these people that are needing care in the waiting room. They're having to chart on a patient laying in a bed in the emergency room that needs a bed upstairs, but they don't have the nurses to do it. They want to make out like it's because the nurses want these exorbitant rates. No, we just want to get reimbursed for what we do correctly. Unsafe staffing numbers. You get a nurse that has more than 6 patients. 6 patients per nurse in the acute care setting or the hospital setting is quite enough. Depend on the severity of care they require for those 6. If you've got 6 acute and 6 fixing to go home in the next day or so, it's not so bad. If you get 6 acute, it's busy bad. But you've got ER nurses doing life-saving mechanisms in one room while they're having to still care and chart on the patient next door that may not require that, but they're not being seen either. And if there's a complication that pops up in a stable patient and they're already working on one, somebody's not going to make it because there's not enough staff in that department, which is what's happening all over the country. American Emergency Physicians asked doctors to see. The main thing they heard was patients dying waiting rooms because the ED was so overwhelmed in some of these bigger areas. They had to wait hours to see a physician and get any care, and they were dying, and they're still dying. It happened 35 years ago. It's happening today. It's got nothing to do with too many ED patients or insufficient staff shortages throughout the hospital. That's the problem. The reduced capacities at nursing homes have required some of these nursing homes to go back to business hours on admissions. That backs everything up because then it becomes first come, first serve, or we'll take them, but we can't take them to Tuesday next week. The problem that we have is hospitals don't have any incentive to fix it. Misaligned healthcare economics is a primary driver of boarding in the ED. It's better business for hospitals to keep the medical floors near capacity and prioritize beds for surgical than to bring more money and not leave the buffet rooms available. If 90% of the beds are full that's available to be open, hospital revenues probably be optimized, but then the ER gridlock starts. It becomes inedible. The only standard set by CMS on ED boarding is a recommended 4-hour maximum boarding time. We're way, way, way past that now. No mandatory reporting requirements about this issue. The special session of Congress was called 35 years ago to make the lawmakers and the public aware of stories of patients that's left to die in hospital parking lots because of the lack of care, and we haven't done any damn thing about it now. Nobody's standing up and fighting for these people. Nobody's being an advocate for their patients. It's wrong. It's fundamentally wrong. Nobody's standing up for the staff members in these long-term care facilities. Nobody's standing up. Patients are waiting days. Sometimes there's parts of this country where patients are waiting a week or two at a time. It would be similar, if you teach school, it would be like, okay, there's a month of school left to teach. But what we want you to do is we're going to give you these students to teach and finish up, and we're going to give you a whole new class on top of it to teach and start right now. It's the same thing in the healthcare field. We have a broken system. Nobody's doing anything about it. You have all that going on, and then you have these nurses burning out. Nurses are being crushed under the responsibilities that's been magnified by the shortage. Where are the companies? They're not nowhere to be found. They do not care. As long as their bottom line stays up, that's all they're worried about. This article I read had the stupidest ending I have ever seen in a healthcare journal in my entire life. They wrote this whole article, and in the end of it, they said, we call on HHS and CMS to find a multi-pronged approach to clarifying the problem of ED boarding and identifying solutions. The government ain't helping you now. They didn't help you with the ACA Act. And you think they're going to do something about it now? You have got to be an idiot to think the government's going to help you do anything. Look what they caused with the mandate of an immunization that nobody had researched. And they can talk about it all they want. They can take me down on these platforms for saying it. I'm going to say it. The direct cause of what's going on now resides in the 10 square miles in Washington, D.C., and with 535 members of Congress and one CEO of this country called the president that refuse to do anything about it because they're in the pockets of the lobbyists and they're in the pockets of these 400 or 500 companies that own these hospitals and nursing homes. They refuse to do anything about it because the politicians are scared of losing money out of their back pocket. You want to ask how to fix a facility? You want to ask somebody how to fix what's going on in this country? Ask a fucking nurse. Because the first thing they're going to tell you, it's not the pay, it's getting some help. They won't do that because they don't think that they're being selfish, and that's all they're. These owners of these companies, the owners of these conglomerate hospitals, are ignorant to what their staff actually could help them do. They're ignorant because they choose to be ignorant. They're ignorant because they have a board of 10 or 12 people that tell them, you're going to make this amount of profit for us because what matters to us only is the bottom line. But yet out in the public, they put on this big show about how they really care, but they don't. There is no strategic reevaluation of the healthcare delivery system in this country. The current model we're under was invented in 1913 by fucking robber barons that were told to break up Standard Oil and American Steel. And they financed it through J.P. Morgan. You want to know where the problem is? Start there and work your way forward. You'll see it happen over and over and over. I have an episode on this exact issue and where your healthcare delivery system is going. I believe the title of that is If It's Broke, Don't Fix It. We didn't need the pandemic to tell us that we had dire consequences for patients coming in the hospitals. We didn't need a pandemic to tell us that there were dire consequences for patient care and long-term care facilities. I'm going to tell you how stupid it got during this COVID situation. And they called it because they were advancing healthcare. Let me tell you how stupid it got. We had an organism that we knew nothing about that was taking over and going to kill everybody. They sent in all of this money from all of these grants to these facilities to help them out. Right behind that, they sent in what we call in the long-term care industry surveyors from the federal government to see if we were washing our hands correctly and if we had a setup that they didn't standardize in any facility anywhere. They said, you just need a clean side and a dirty side. But then when they came in, they had all of these regulations. That's so they could find them and get the money back they'd given them back in the grant money. Now, where did all that money go that they find these facilities at? See, it was supposed to be for paying the employees, but they couldn't give them that much, so they had to come get it. And they did that by, it's an infection control issue because we don't know this organism. Neither do you. Neither do we. There's no learning curve here. It had to be precise and exact. You talk about facilities that did it right. Though they didn't do it right, they just did it with common sense, and they're the ones that benefited. Maybe they knew the federal surveyor. Maybe they knew the state surveyor. But infection control survey was always initiated whenever they hit the building, when they were allowed to come back in the buildings, because it didn't matter what kind of care they got when it was acutely first started, because the powers that be, let me rephrase it. The powers that be from the CDC, the FDA, CMS, HHS, the National Institutes of Health, and his dumb ass Fauci, they just changed the rules every day. I remember at one point we had one rule at 8 o'clock in the morning, and we had another phone call at 3, and there was a whole new rule put out. Now, how can you take care of patients when you don't know from one 6-hour time span to the next what the new rule is going to be? You don't implement it. You just don't. There's no standard for that. There's no standard for when you don't know what you're dealing with and you expect the facilities to fix everything and have it done what you're thinking, but no guidance with. That's the problem. That's the problem here. Then they wanted to fund, but then they wanted to take the funds away from them. See, that's where the ignorance comes in. That's where you see exactly where your mom and daddy staying. And they could have fixed it real easy, but they have now decided that instead of fixing the problems at home, instead of taking what we know we got a problem with and know where the problem is to fix it. We know it's going to require money. I don't say throw money at every problem, but acutely to fix it, it's going to require billions of dollars. But instead of turning the money and giving it to long-term care and the hospitals to fix their problems, last year they decided to send $113 billion to a war that we don't really know that's going on. The other day, the president, instead of going to Ohio, where we had a national disaster happen, decided he was going to fly halfway around the world to the Ukraine. And while they were walking, a fake air raid siren went off. And everybody watched it. They act like it was perfectly normal. It was so normal, in fact, nobody took cover. They want you to think that you've got this bad guy and this good guy. Well, as far as I can tell, all of them ain't no good. We don't have good congressmen. We don't have good senators. In the very least, we don't. Like I said before, 535 members of Congress, and nobody's doing crap to help these people. I take care of these people. These people paved the way so I could do what I'm doing. These people paved the way so you could do what you were doing. These people paved the way by ensuring your freedoms at home. And yet the current administration and previous administrations also, but the current administration and the current Congress haven't said a word about how we're going to fix the staffing shortage in America, how we're going to fix the healthcare facilities in America, what's the best way to do it, how easy is it to do it, and what they need to do it. They've sent enough money for a war that we're not sure is being fought, to have ended world hunger and stopped the healthcare crisis in America at the least. At the fucking least. But yet nobody's standing up. Nobody's growing nuts enough to go do something about it. They say the money could be better used at home, but they're not saying where. They're not standing up and saying, Grandma needs money to keep her bed in this nursing home because our nursing home directors, our nursing home corporation, our nursing home conglomerates would rather close a building than get the funding to keep it open so Grandma can stay close to home where their family can visit them every day. Instead, we're closing nursing homes and sending them 20 to 30 to 40 minutes up the road, or we're sending them 50 to 100 to 150 miles away from their home, and yet the state's going to come in and fine you for not providing a home-like environment. Who's leading by example? Because it's not the government and it's not the owners of these corporations. So who's it falling on? The family members are trying to blame the healthcare facilities themselves for the problems that's being incurred. And it's not being incurred because the people that working in the facilities can't do their job and they don't know what they're doing. The problem is the people that work in the facilities are being told by the administration not to do your job. It's going to cost us money. You don't get to have the people to work on the floor with you side by side to take care of the residents that we got in this building, because what's more important to us is the bottom line that goes to our board of directors. It's the bottom line that goes to our bonuses every year. It's the bottom line. It's the bottom line. It's the bottom line. When's the bottom line going to be available for the people that live in these facilities? When's the bottom line going to be? We used to care about people in America, but now we don't give a shit about them. We used to care about people in America, and now we don't care if you survive or not. 35 years ago, we thought it was so important we called a special session of the National Congress to take care of the problem. And nobody's doing a damn thing about it now. $113 billion is a lot of damn money, but it's a drop in a bucket to a $3 trillion budget that they have come up with in the government. And they only give the same amount to the Department of Health and Human Services that they give the year before. You got to keep in mind that money goes for Social Security checks, disability checks. It goes to hospitals. It goes to pharmacies. It goes to all these other places, but there's no increase anywhere except we're going to send money. Like I said, and I keep reiterating it, we're sending money to a country that don't deserve it. We're sending it to a country that don't need it. And we're sending it to a country that's not even in a real war, because I'm going to tell you right now, everybody's thinking it but scared to say it. Here it is. Big Dave's going to say it. If Russia wanted to squash the Ukraine would be squashed. We all know it. I said it. Take me down if you don't believe it, but I think you're going to find that the people do. You're going to find at some point People don't care about a war that we have no benefit from being in. Even if it's real. I don't believe it's real. But even if it is real, people don't believe in it over here. Very few. The ones that do are what we call woke. They just support it because they don't want to look like a fool. They got voter's remorse, but they'd rather not look like a fool than to be a fool. We're not tracking any of this money that's going overseas. If you did, you'd be absolutely disgusted. We're not tracking. Why does a member of Congress get paid $175,000 a year? More in some places. They can make for what the president makes $4.25 a year, $425,000 a year. Why they get paid exorbitant amounts of money when their grandmas down here in nursing home get paid $240 a day on average? Some states I've seen were $166, $177 a day. That's not enough to take care of the medicine, pay for the help, and feed them. It's not a guaranteed right. No, it's not a guaranteed right. But if you're going to offer a program, put them on the program and not give the money to do the program. Why have you got the program to begin with? Peter and Paul. This is borrowing Peter to pay Paul. And nobody still got the money. We've run on this system for years. It's not worked. It's caught up. As Jeremiah Wright said, the chickens have come home to roost. And nobody's doing anything about it. Why? Because they're choosing not to. They're choosing not to. We sent $113 billion to the Ukraine last year. If they really cared, if this Congress really cared, the current one and the previous, if they cared about you, if they cared about your family, if they cared about the healthcare system in America for all Americans, like they're supposed to do, they would have taken $100 million of it, sunk it into the system by giving it to the states to better distribute the stuff instead of trying to keep their hands in every dime they try to send to take care of your grandmother and your grandfather. Then we wouldn't have this problem in America today. But they do not care. And what happens is you keep voting them in. You keep pushing them in. You're more worried about red and blue pills. You're more worried about Democrat and Republican than you are worried about your kids, yourself, your spouses, your grandparents, your aunts and uncles. You're more worried about being right on a political spectrum that doesn't make a damn if you're dying or where you're dying. Only when you die, that's when you care. Well, Mama didn't have a bed. She died in the emergency room. And we're going to see you for it. Why? Because you were not proactive. You were just reactive. These facilities are not proactive. They're just reactive. And as long as you've got this system, you're talking about a collapse of the healthcare system itself. The system will implode. There's no stopping it now. Because y'all are choosing not to do anything or to stop it. It would take one person in Congress to have something happen in a nursing home, and I guarantee you they'd be all over it. But they're more concerned about another country's borders, even than they are of their own. They're more concerned about giving $7 billion of humanitarian aid last year to the Ukraine for humanitarian relief. Where's the $7 billion for grandma in the nursing homes humanitarian relief? They're still sitting in Congress, or are they working on another bill to pass? They don't want to take care of your folks, people. Like I said, if the system's broke, don't fix it, because it puts more money in their back pocket. It puts more money. So how do we fix it? Where do we start to fix it? Well, the very first thing we do to start to fix the problem that's going on is call attention to it. The people that have people in these facilities need to call attention to the issues that they're having, and not by themselves. Have entire communities where these nursing homes are being closed. Contact their local, or when they were doing the base closure commissions, when Clinton was in office, they would have all these air shows and all the support and all these local support. If you do that in your communities, you might be able to salvage. Here's the problem. Until they decide it's a problem, until they want to make sure that there's going to be places for people to go years down the road, months down the road, until they're sure they want to be able to pay the nurses that run the hospitals. Because the last time I checked, a nursing home, what runs it is in the title of the facility. It is a nursing home driven by nurses, driven by the power of nurses. Facilities don't want to admit it. Hospitals, same way. You can't have a hospital if you don't have a nurse to disseminate the doctor's orders. Because, see, it's really the nurse's job to make sure that the doctors don't kill you. And see, and the problem lies here also. All this wokeness that's been going on the last couple of years has now found its way into medicine. Everybody thinks it's okay to groom a child for whatever reason. They think it's okay to teach sexuality into the classrooms. They think it's safe for the doctors to push sex change operations on teenagers while they're in office because they're worried about a little depression, because they don't know what their sexuality is, because they never had a girlfriend, never had a boyfriend. Well, I'm a boyfriend, never had a girlfriend, I must be gay. Well, that's not really it. I identify as a girl. Identify. You are what you are. Your sex shouldn't matter. But that's not what they're worried about. They're worried about getting them bottom line dollars. They're worried about cutting everything they can cut out, including the very patients that's supposed to be there to keep them open. It's a sad, sad day in healthcare. It's a day we realize that healthcare is imploding upon itself. And we can stop it. But nobody's choosing to take the initiative. We can stop it, but nobody cares if it's stopped or not, because as long as it's not directly affecting them, then there's nothing going to be done about it at all. At all. I used to enjoy being a nurse. I used to enjoy what I do. It's not that I don't like it now. It's that it's not like it used to be. We used to knew we were getting ripped off, but we knew it, but we had enough help to know we were. Now we know we're getting ripped off, and they don't care if we got enough help or the illusion of help anymore. They deliberately understaff to increase the bottom line. And until that's made illegal, or all of these corporate for-profit entities are made non-profit, period, then it's going to always be this for as long as it lasts, which ain't going to be much longer at all. So as you finish and listen up this show, I appreciate you joining me this week. I'm going to end you with this, and then I'm going to break down a little bit of podcasting for you. What are you willing to do when you have somebody in a long-term care facility or goes to the hospital? Or what are you willing to do when you find out they're going to be waiting in the emergency room for 9, 10, 12, 14 hours, up to a week because they don't have no bed? Are you going to be mad because take it out on the nurse because the nurse can't control it? Or are you going to start questioning the people that matter? You're going to start asking for the house supervisors. Or you're going to start asking for, I want the house supervisor. I want the chief nursing officer. I want the CEO. I want the CFO to come answer my question. Because nursing deals with nursing, not the operations. I want the operations, a facilities manager. I want somebody to answer me why my mama can't get a room. I want somebody to answer me why my child can't have a bed. Because that's where we're at right now. You know what you're going to be asking yourself? And I don't want nobody to ask themselves this, but you know what's coming? Hey, there's David. He used to be a nurse. Maybe he knows how to help stop this bleed. Maybe he knows how to sew her up. Maybe he knows what medicine to take. Maybe he's got some hydrocortisone cream that he's stocked up on. Once you listen to my podcast, if you're looking for more podcasts to listen to, I have a couple of suggestions for you. One is called Renegades Rant. It's based out of Henderson, Kentucky. Very cool host. Discusses a lot of information. Has a lot of guests on his program. Pretty good common sense guy. I've been on his podcast a couple of times. I really enjoyed my time there. Great guy, great show. Give him a listen. Subscribe to him. Do automatic download. Who knows? You may just listen to him. He may have that voice and style of podcast that you need to lay there and listen to till you go to sleep. But he's a super informative guy, cool guy, and he's based out of Kentucky. And another good podcast I listen to is out of the Spokane area of Washington State. It's called Little Extra Lambo. I've been on his show one time. I'm hoping he'll ask me to come back. But great show, great host. I had the best times. The longest podcast I've done to date at 2 hours and 30 minutes. We talked about everything under the sun. I'm hoping we can do that soon. I would like to thank everybody that stopped to tune in and listen. I hope that I've given you some information. I hope that you become as passionate about this issue as I have. I hope that if you have questions, you'll send me an email at ridgerunnerstudios@protonmail.com. I'm your host, Big Dave. It's been a pleasure to be with you this week. I trust you have a great week. And take care of yourself, because you may be your only hope.
You have been listening to The Nursing Underground, a podcast dedicated to informing you of the white noise in politics and healthcare, and helping you redefine the trees in the forest. Join Big Dave again next week in The Nursing Underground from Ridge Runner Studios.